welcome to Court's Facebook Live event where we like to highlight some specialty programs that you may or may not be aware of. And I really appreciate you all taking the time out of your day to hear about Court and how we're forever growing in the physical and occupational world to better serve you. My name is Sara and I've been with Court for the past 8.5 years. And during this time, I've treated several vestibular patients, which is actually the topic of today's discussion, so the vestibular rehab program. So I have two other people that are here with me right now to kind of go with the question and answer format. But if you do have a question during this time, feel free to comment in the comment section or direct message us, and we'll try to get to them as best as we can. But if we can't, we'll go ahead and respond to you afterwards.
Awesome. So I have a list of questions and we're just going to kind of run through them. First question, what is vestibular rehabilitation and what are common conditions it can treat?
Okay, so what is the vestibular rehab therapy and what are common conditions that it can treat? So first you need to understand what the vestibular system is. So it's a sensory system in your inner ear, and it's the leading contributor to your sense of balance and your body's awareness in space in order to coordinate movement with balance. Okay, so the vestibular rehab program is a specialized form of therapy that's intended to alleviate problems that are caused by vestibular disorders, specifically more like vertigo and dizziness or imbalance, gaze instabilities, and falls. So some common conditions that we do treat are benign paroxysmal positional vertigo, which is long for BPPV, unilateral vestibular hypofunction, Meniere's disease, labyrinthitis, persistent postural perceptual dizziness, which is also a mouthful, and that's commonly called 3PD, and also cervical dizziness as well.
Yeah, say those words 10 times fast.
I know, can I just buy a vowel within those?
Second question, how is vestibular rehab different than concussion rehab?
Okay, so how is vestibular rehab different than concussion rehab? So vestibular rehab is designed to alleviate problems that are related to vertigo, dizziness, gaze instability, balance, that sort of thing. So when someone says concussion, you kind of think of these athletes that play these high-impact sports such as football, soccer, basketball. But actually, concussions occur in regular day-to-day activities in everyone's daily lives. So concussion involves a trauma to the brain, and while we do utilize them as well, we have to look at other factors, which include cognition, anxiety, their mood, do they have headaches, neck issues, those kinds of things. So while several of those treatments, we use that in conjunction with that, I don't want to get too involved in the concussion rehab discussion right now, just because we want to focus a little bit more on vestibular rehab itself. But if you do have questions about concussion rehab or want to be seen potentially for that, you can give us a call at 1-800-645-KORT, and one of the specialists there can actually get you set up with a good clinic to kind of evaluate you for that concussion discussion.
Awesome. Who can benefit from seeing a physical therapist for vestibular rehab?
Okay, so who can benefit from seeing a physical therapist for vestibular rehab? So anyone who feels off balance, dizzy, or has vertigo, or individuals at are at risk of falling can benefit from vestibular rehab. So one of the biggest complaints that I'll get from patients that are experiencing these things are they go to the grocery store and they just feel overwhelmed or dizzy just from looking or just walking down the aisle, or even just bending over to pick up their groceries or reaching upward. And that can't happen because you need to be able to go to the grocery store. Girls gotta eat, so can't be falling over or not being able to go inside of a grocery store for your own needs. Another common complaint that people have is getting dizzy or having the room spinning when they change positions. So laying down in bed or rolling over, bending forward, or even looking up, those kinds of directions can put a person at a risk for falling if you do experience dizziness during that time. So with that, we want to make sure that I let you know that that's not normal to feel dizzy when you have those things happen to you. So if you have any of those things happen, we need to go ahead and get you set up for an evaluation with a vestibular rehab therapist.
Awesome. If a loved one or I have fallen in the past 6 months, what should I be looking for?
Okay, so the question is, if a loved one or I have fallen in the last 6 months, what should I be looking for? So you have to ask yourself several questions. So what, did you feel dizzy? Was the room spinning? What direction did you fall? What kind of caused you to fall? Like, were you turning, bending over? Were you looking up? Were you standing up? That sort of thing. Was there a loss of consciousness? And also, was there any change in your medical history or any of your medications recently? So if you answered yes to some of those questions, then you definitely are a good candidate to be evaluated by a vestibular rehab therapist. So, go ahead.
What can I expect during a physical therapy visit for vestibular rehab?
Okay, so what can I expect during a physical therapy visit for vestibular rehab? So at court, we do our very best to try to get our new patients in within 24 to 48 hours, as it is not fun feeling dizzy at all. So we don't want you to be at risk of falling, so we really want to try to work hard to get you in as quick as possible. So we even have extended hours in the morning and in the evening to try to accommodate everyone's schedule the best that we can. So during your first visit, we evaluate you. We kind of figure out those areas where there could be some sort of dysfunction. So we look at your ocular movements, so how your eyes are moving. We do positional testing and balance testing, and also we even look at how your neck is moving as well. So this will all help to determine what treatments to do and also what exercises to give you for home.
Which leads me into my next question. What are examples of exercises for vestibular rehab?
Okay, so what are some examples of exercises for vestibular rehab? So I'm going to show you 3 different eye exercises that I commonly give people that have this dysfunction. So the first one is called smooth pursuit, and what you do is you can just use your own finger out in front of you, and you want to keep your head still, and you're going to follow your finger with your eyes back and forth. So this is helping with smooth tracking motion coordinated with both of your eyes there, and you can change directions too. So then the second exercise I want to give you is called, is for saccades, and that is with rapid eye movement between 2 fixed targets. So, for instance, you can take your 2 fingers, keep your head still, move your eyes back and forth kind of quickly, and then also you can change direction as well for that. And then another one, which is my favorite, is the pencil push-up, which I'll just use my finger for this one. So literally, you're going to bring your finger inward, which is going to help your convergence. Go cross-side, bring it back out, and this is a very complicated move for your eyes, so this is a great exercise to kind of get your eyes moving in the same, or moving together.
Awesome. How long will I be in rehab for vestibular rehab?
Okay, so the question is, how long will I be in rehab for vestibular issues? So that depends on several factors. So the evaluation first is going to identify the areas that are requiring treatment, but some conditions will be treated and you'll have great improvement in 1 to 2 visits. That's awesome. That's what we would love to have happen. Unfortunately, that's not always the case though. So sometimes patients may require several weeks or even months in vestibular rehab, but the important part is making that good progress with everything. So that's the biggest thing, because we want to make sure that you're not living life feeling dizzy or imbalanced or falling or anything like that. But it is very important for you in this whole process to be compliant with the home exercise program that they give you, but also attending your appointments regularly.
Great. Does my physician have to make a referral for me to have vestibular rehab?
Okay, so does my physician have to make a referral for me to have vestibular rehab? Well, that depends. So Kentucky and Indiana are direct access states, so several people do not need a referral from their doctor in order to have vestibular rehab first. But in the event that some insurances do require that to happen, most doctors are perfectly happy with sending over an order for vestibular rehab, especially if you already saw them about this issue in a previous visit with them. So if you do have questions though about your insurance and if you require an order or not, please feel free to give a call to that 1-800-645-KORT number, and someone on that line can help you with your insurance benefits and see if you do require an order or not. Or another option is just to go to the closest court clinic that is near you, and the patient service specialist at the front can help assist you with that as well.
Awesome. What if I'm unable to come to an outpatient court facility for my rehab needs? Do you all have options?
Okay, so what if I'm unable to come come to an outpatient court facility for my rehab needs, and do I have options? So yes, you do have options. So the optimal choice for vestibular rehab is in the outpatient clinic setting. And this is just because we can be more hands-on and we have more equipment at our disposal to really fully evaluate you and do all these different tests to kind of get the best picture of what your needs are. But and it's best to do that, but there's other options as well. But we have 57 clinics in the states of Kentucky and Indiana, so that have a vestibular trained physical therapist. So if you're able to get into one of those, that would be great. We're following all CDC guidelines with safety, wearing our masks, social distancing, cleaning all of our equipment. So, that is the best option. However, we do have other options if it doesn't work out for you in that way. So telerehab is another option where a vestibular trained therapist will do a live chat with you, a video chat, so that way they can look at your eyes and look at other parts of the evaluation, and then kind of decide where to go from there and what the best course of action is. But if that doesn't work out as well for you, there's also our rehab to home option with our outreach program. Shout out to outreach over there. So what they do is they'll have a vestibular trained therapist actually come to your home, so that way they can evaluate you and treat you right there in your own home, and then go from there as far as what the best course of action is going forward.
Great. How can I schedule an appointment with court to see a trained vestibular physical therapist?
Okay, so how can I schedule an appointment with court to see a trained vestibular physical therapist? So there are multiple ways to set up an appointment with one of our vestibular therapists. So first, you can go onto our website, which is court.com, and look up the list of the different locations, especially finding one that's closest to you is usually the most convenient. You can get that number and call that clinic, and the patient service specialist can help you set up an appointment at that time. Or while you're looking up our website, you can actually there's a live chat feature, and that person on that line can help set you up with a good clinic with a vestibular trained therapist and a good appointment time for you. But if all else fails, there's the lovely number 1-800-645-KORT, and that's our centralized scheduling, and they should be able to help get you set up as well with a clinic that's most appropriate for you based on your needs.
Love it. I love it. So let's just take a second and look through our live chat and our messages to see if we have any questions. It does look like I have one. What if I do not see any improvements after going through vestibular rehab?
Okay, so what if I don't see any improvements after going through vestibular rehab? So there are a couple things to go on with this. So first, the physical therapist that is treating you needs to kind of evaluate and see, is there something that we're missing? Is there something else that we should try? So that's the first step. Other parts of that too is, I'm going to ask somebody else, one of my colleagues, that is very experienced in this whole vestibular program as well, is there something that I'm missing? I want to get a different perspective from them just to have more eyes on the whole situation. And if all else fails, we can also just make sure that you're going to be taken care of by referring you to the appropriate person. So whether that's back to your primary doctor, or maybe an audiologist, an ENT, or a neurological doctor. So either way, we're going to have good communication with them to kind of make sure everyone knows what's going on with you, so that way you can have the best treatment possible and hopefully not feel dizzy or off balance anymore. Okay, so I think that's all we have time for today. So I just want to kind of reiterate that court has many specialties across Kentucky and Indiana that can help you with your vestibular issues if you have any. So if you have any questions about your ailments, please feel free to call 1-800-645-KORT, and somebody there can assist you with any of your needs, scheduling or figuring out where you need to go. We don't want anyone to have to deal with being dizzy or being at a risk of falling, but if you do have anything going on like that, court is here for you, and we want to help you get better, okay? So I just want to say thank you so much for joining us today, and I hope today's segment did enlighten you a little bit more about our vestibular rehab therapy program. So have a wonderful rest of your week, and we hope to see you soon.